we looked at incurred PMPMs for both MODA and Kaiser Permanente. We had data with MODA that got us through, I believe, November. We definitely had significant care deferral in April and May. You've heard of that. The interesting information is that it's pretty much come back to normal. A year to date, we have a decrease in medical PMPMs, per member per month cost, of about 10%, while pharmacy increased 7%. With Kaiser Permanente, we have data only through, I believe, July or August. I'm sorry, August, and there we haven't seen that same rebound. However, we're in a shorter period of a window. It takes longer for us to get information in terms of cost and utilization back from Kaiser Permanente. Interestingly, for mental health, we're seeing ongoing increased costs and utilization. We spent some time talking about telehealth with MODA in-person outpatient has dropped 27%, but when you combine it with telehealth, it's only down 6%. And 63% of those telehealth visits are for mental health. With Kaiser Permanente had started with a much higher use of telehealth in the about one visit per year per patient. Now it's up to 2.5 telehealth visits per person per year. 33% were mental health. Okay, then we looked at specifics within behavioral health, MODA. Again, about a 50% reduction in-person visits, but when you combine it with telehealth, up 19% over the previous year. For Kaiser Permanente, the in-person mental health had dropped 71%. However, the combined office visit and telehealth was up about 10%. Moving on to dental utilization, it's the same pattern that we just talked about in terms of the medical utilization. First, we looked at Delta Dental, comparing 2020 with 2019. If you remember, dental offices essentially, except for emergencies, closed for 8 to 9 weeks. I mean, they just were shut down completely. So when we looked, that represented about 12% of the year. And when we look at, again, for Delta Dental, their preventive visits for the year, this is through December, I think through December, they were at 86% of 2019. Cleanings were 87% of 2019. Fluoride treatment, 92%. Sealants, 86%. When you look at the things that were allowed during the late March through early May, that were allowed, that include endodontics, which is like a root canal, or oral surgery, they were at 99 or 100% of utilization. So that showed that people were getting in for the things they absolutely needed, and yet they're now rebounding to basically to baseline or steady state. We looked then at Kaiser Permanente. They are at 82% utilization as compared to 2019. When you include virtual visits, is up to about 90%. Their backlog is resolved. In terms of basically all services are essentially back to 2019 levels, except for periodontal and fillings. The thought is that there still is some reluctance in terms of people going in to get care. The Willamette Dental Group talked about, they also saw this huge, fall off, and they're working now back up to normal levels. If you look at their 2020 versus 2019 utilization, it's 84%, again, allowing for this 2-month gap. In December, they were up to 94% of that utilization. We talked about the one request that they had, which was to actually waive the $20 copay for people who had never been seen before. They have already have appointments now for about 440 OEB members who fall into that category. So that's also very exciting. So essentially what the dental providers and programs have been able to do is get back to baseline, digging out of the holes that were made when people were not able to get care. So that was CIAO's work for the day. Any questions or comments? So Jeff, the other thing that I was scheduled to talk about today was social determinants of health from my perspective. And I was going to, I had three kind of cute stories that illustrated it. And it's 10 after 4, and so I'm not going to delay the meeting much longer, but I do want to throw out what I think are three critical elements of where healthcare matches or meets up against social determinants of care, and in particular one that the as OEB should pay attention to. The first one is language. When people come in from different cultures and where English is not their primary language, and then they are confronted with a health system that only works in language, there's poor care. It's on every level of it interferes with education, explanation, understanding what complications can result in, really understanding what's going on with the patient and understanding what their wishes are and how the family is going to interact. So language is important. It's one of the quality metrics that the Health Plan Quality Metric Committee that sets in a way the quality metrics that we as OEB and PEB can use is looking at, and we'll be talking about bringing that into our next year's quality metric system. The other one is, and this is one where I think our plans have done a darn good job, and the talk that we just had about MODA 360 is around how social support systems like navigators are critical for good healthcare. And you can have the best healthcare system in the world in terms of technical quality, but unless it meets the patient with what their needs are when it comes to housing and finance and transportation and all the things that we heard about at last month's board meeting, it just falls through the cracks and people don't get the care they need. And the final thing that we are starting to think about and trying to figure out is around the inequity that we see in our system related to race. There is, when you do big studies, you find that people of different, essentially people of color, struggle with getting equitable health care. And it's in the statistics. And my understanding is we don't even at this point have a way of knowing whether or not that's happening for the people that we're responsible for. And so that is going to be one of the big challenges that OEB and PEB has in terms of coming up with ways for us first even to understand the problem and to be able to document what's happening in terms of health outcomes related to ethnicity and race. And then it's going to be partnering with our health plans and the systems that they work with to come up with a better future. So those are the, I'll spare you all the stories, and when we have more time, I'll tell you some kind of interesting stories that relate to these.
Thank you, Tom. Bob, did you want a response to that? Because I know you spent a lot of time on this subject.
No, that's fine. That's fine. Nice job, Tom.
Thank you.
Okay, do we have any public comment?
No public comment.
Okay,
That I know of.
okay. With that said, I'll adjourn the meeting.
Bye all.
Thank you.
Thank you.
Thank you.